Hello, everyone. This is Dr. James, biomedical neuroscientist and also holistic health coach. Welcome to the Holistic Health Corner. Today, we're going to talk about something that's very important, and that is hypertension and how to naturally reverse hypertension. What is exactly high blood pressure? High blood pressure is a condition that results from an increased force of blood moving through your arteries from your heart, which pushes against the walls of the arteries and over time can cause many problems. Every time your heart beats, it pumps out blood, and at the rate in which it does determines your blood pressure. It's natural to have higher blood pressure at certain times, like when you're stressed or exercising. But chronically high blood pressure starts to wear down arteries and increases the risk of things like coronary heart disease, stroke, heart attack, diabetes, or even kidney damage. High blood pressure is considered anything over the normal level of 120/80. It is caused by a number of factors, including low nutrient intake, a poor diet high in sodium, obesity, or being overweight, smoking, lack of physical activity, or what we call a sedentary lifestyle, high amounts of chronic stress or other compounding medical problems, and a family history of high blood pressure. Most Americans don't even realize they have high blood pressure until serious problems arise. Results of high blood pressure include arterial damage, aneurysm, blocked or ruptured blood vessels, reduced kidney functions, vision loss, heart failure, loss of cognitive function, concentration, memory, and ability to learn. Metabolic syndrome, a cluster of metabolic disorders such as high cholesterol and insulin, atherosclerosis, and increased waist size. Causes of high blood pressure include a high salt diet, emotional stress, alcohol, caffeine, heavy metal poisoning, smoking, obesity, inactivity, birth control pills. Frequently, there are no high blood pressure symptoms as blood pressure increases, but some warning signs for very high blood pressure can include chest pains, confusion, headaches, ear, nose, or buzzing, irregular heartbeat, nosebleeds, tiredness, or vision changes. When high blood pressure symptoms do develop, it's normally because the condition has progressed to a dangerous point. This is called hypertensive crisis, which means the systolic top number higher than 180 or the diastolic bottom number higher than 110. Hypertensive crisis is considered a medical emergency that requires immediate attention. Emergency medical treatments is needed. At this point, symptoms are usually present, including severe headaches, severe anxiety, shortness of breath, nosebleeds. At the age of 50, total life expectancy is about 5 years longer for people with normal blood pressure than for those that have hypertension. That's just another worthwhile reason to get your high blood pressure symptoms under control and keep them under control. Also keep in mind that readings above are if you have diabetes, kidney disease, or short-term serious illnesses, your readings will be interpreted differently. If you have diabetes, another very common problem, or a chronic kidney disease, then higher blood pressure is defined as 130/80 or higher. Obesity or being overweight increases the odds because this puts more pressure on the heart and the arteries. Men and women are equally likely to develop hypertension during their lifetimes. But interestingly, men are more likely when they're younger. Before turning 45, men are more likely to have hypertension than women. But then this flips at age 65, when women's risk becomes more higher than men's. When children are younger than 10 years old, they have high blood pressure. It's usually a side effect of another condition. This can include a kidney medication use or type 1 diabetes. Let's talk about the root causes of high blood pressure. Knowing what triggers high blood pressure can help you prevent or reverse it. Like with most other chronic diseases, the reason someone develops high blood pressure has to do with several factors. High blood pressure seems to run in families, but it also highly dependent upon the type of lifestyle someone leads. Women are at an increased risk when taking control pills during pregnancy or taking hormone therapy medications to control menopause symptoms. High blood pressure has a real laundry list of risk factors. The good news is that the majority of these hypertensive risk factors are well within your control. They include age, family history, race, being overweight, not physically active, tobacco use, too much alcohol, stress, pregnancy, too little potassium in your diet. Certain chronic conditions may also increase the risk of high blood pressure, such as kidney disease, diabetes, and sleep apnea. High blood pressure is most prevalent in adult population, but children are at risk sometimes. Children can experience high blood pressure symptoms that are caused by problems with heart and or kidneys. However, more and more children who experience high blood pressure are dealing with this chronic issue at a way too young age because of their poor lifestyle habits. When I say poor lifestyle habits, I'm referring to an unhealthy diet and a lack of exercise, which both directly relate to the increased childhood obesity and childhood hypertension.